day, I am Maria Angelica Bioran from BSN 2A. So for today, I'll be performing or demonstrating the proper procedure in deep breathing exercise. But first, let me define the two breathing that is involved in deep breathing exercise. The first one is the pursed lip breathing. So it is a technique that allows oxygenation and ventilation, which is done by breathing in through the nose and exhaling through the mouth with a slow and controlled flow. And then the next one, or the diaphragmatic breathing, it is a type of breathing exercise which involves fully engaging the stomach, abdominal muscle, and the diaphragm when breathing. For the purposes, first is to remove the air that is trapped in the lungs by slowing down the respiratory rate and relieving shortness of breath. Second is it to help strengthen the lungs and assisting in emptying the lungs of retained carbon dioxide. And then third is to increase efficiency of ventilation and oxygenation. And then last is to improve the gas exchange and oxygenation. For the materials needed or the article needed, we only need a folded towel or pillow, but I'll be using pillow. And then, for the points to remember, first, forceful expiration or forced expiration during pursed lip breathing must be avoided. First expiration, while the lip is pursed, can increase turbulence in the airways, which can cause further restrictions of small bronchioles. And then, avoid the use of excessive abdominal muscles. And then, lastly, allow the patient to perform deep breathing for only 3 or 4 inspirations and expirations at a time to avoid hyperventilation. So for these special considerations, consider administering analgesia as ordered prior to starting. If the patient has pain, they will not be able to perform the exercises. And then second, mobilize the patient to ensure that they do not acquire infection or atelectasis. And then third, sit the patient out of bed or up in bed. This position aims to optimize lung expansion. And then, for the critical care patients, they can sit out of bed if they are hemodynamically stable, because this position is better for lung expansion. And ensure you have 2 or 3 clinicians assisting with any intravenous line, cardiac monitoring, and drain tubes, etc. And then lastly, ensure that the patient is comfortable. For the procedures, first, explain the procedure to be done and why it is necessary. Good day, sir. I am Maria Angelica Bioran, a student nurse from Southern Luzon State University. And I am your assigned student nurse for today po, sir. And ngayon po, tuturuan ko po kayo, i-guide ko po kayo ng proper deep breathing po. And yun po ay makakatulong sa inyo para magkaroon po kayo ng maayos na paghinga. And at the same time, ito po ay makakatulong para magkaroon kayo ng proper circulation po ng dugo at oxygen sa inyo pong katawan. And then, assist the patient in a comfortable position, either sitting or lying. So, sir, kaya po ba natin tumayo or umupo?
Kaya naman.
So, kaya naman po. And then, assist ko na po kayo. Upo po kayo dito sa tabi. And then, place the folded towel or pillow up against the patient's chest or abdomen to provide or promote comfort and security around the wounds they may have. So, meron po akong pillow dito. Lalagay ko lang po sa chest at tiyan niyo po. And then, instruct the patient to place the hand on the abdominal muscles. So, bale, sir, lagay niyo lang po yung hand niyo sa may dito po. Okay po. And then, instruct the patient to inhale Inhale deeply and slowly through the nose in a count of 3, then pause. At the same time, instruct the patient to breathe out slowly and gently through pursed lips as if about to whistle. And then exhales to a count of 7. So, bali sir, dahil okay na po yan, and then ang gagawin po natin is inhale po kayo ng malalim at dahan-dahan. And then bibilang po ako ng 3 seconds. And then, yun po, popose po kayo. And then sa pag-exhale nyo naman po, exhale po kayo sa bibig. And then nakanguso po or yung para po bang sisipol po. Yun po. And then yun po ay dahan-dahan lang din. Kakount po ako ng hanggang 7.
Okay.
Okay po, nuggets po ba?
Opo.
Okay po. And then, inhale po ng malalim at okay, 1, 2, 3, inhale po. 1, 2, 3, pause, and then exhale po dandan. 5, 6, 7. So, okay po. Isa pa po. Inhale po. Okay, pause po, and then exhale po. Okay. And then for the documentation, first, document the rate, depth, and character of respiration. And then second, document the breath sounds heard and the placement of sounds. And then last, document or record any signs and symptoms of respiratory distress.